doing service for major distribution centers all over the United States. Publix, Kroger, Stop and Shop, Myers, Wegmans, a bunch of big name companies, like I said, within the United States. Here in Decula, I guess Gwinnett County area, we're at the Publix Distribution Center right here off of 316. What we're looking for is warehouse workers. They operate stand-up Raymond forklifts, Crown sit-down forklifts. We offload the 18-wheelers, sort and separate the product out, and then just pretty much provide a service for Publix to get groceries out to the stores where, if you shop at Publix, that's where you purchase them at. So work-wise, you can make, on average, it is a production-based paid environment. On average, people come out here, they make anywhere from $15 to $24 an hour. So anything over 40 hours overtime, the whole 9 yards. We OSHA certify everybody on site to operate the equipment. And then it's just a trade where if you leave us, you have that under your belt moving forward to somewhere else. We also have something called the OCC, contingency hiring, where we are able to, they can sign up through the website. It's a travel team. We provide hotel stays, per diem money, and then $19 to $22 an hour for them to go out there and help our other locations that needs help. Provide the room and board for them for the time. It's usually about a 6-week minimum contract, you can say. So just like I said, we're just trying to bring more people into the working environment. So I've been with the company a little over 20 years. I actually started in McLean's in Athens, Georgia. I think I transferred to Publix in 2003. But I've also been all over the United States to California, Texas, Buffalo, New York, Virginia. So just some of the locations traveling around too. So great company, full benefits, medical, dental, vision, short-term, long-term disability, 401k. Pretty much anything the big companies provide, we provide them too. So that's pretty much it.
What is your website?
It's a www. Whoa, that's loud.
Yeah, sorry.
www.FHIWorks.com.
And the distribution center is located in Decula, you said?
Yeah, it's right there off 316, Hurricane Trail.
It's just a couple miles east of where the jail is.
Yep.
Okay.
You can almost see it. It's like this gray building, just kind of obscured by the trees, right by
Yep.
right by 316.
Okay.
Fence Road, is it right there by Fence Road?
It's
Oh, yeah.
next road over.
Okay.
Okay. All right, I know where you're at.
So that's pretty much it. I would say I had flyers, but I actually left them in my car. I had to get them rental because I'm going to pick up some traveling people today from the airport, so I was kind of in a rush this morning. But I'll most definitely be back again to provide that stuff where I can get with Rachel and bring some up here later on today.
Sure.
Do y'all have stipulations as far as, I kind of was moving about, not necessarily listening to every word, so you might have already said this. As far as criminal record or background?
We do a 5-year background check, but once again, it kind of depends on what it is.
Yeah.
Like I said, I believe everybody deserves a second chance. So, and like I say, our HR team, they're the ones that kind of handles all that. So.
I'll start out by just a quick intro. I have, wow, this will be 30 years. I've spent 30 years in public safety. Over the last, retired from Gwinnett Fire after about 28 years of service. I worked anything from an ambulance to a fire truck to a ladder truck to a supervisory position. So I kind of saw all different versions of what was going on in public safety, worked directly with law enforcement at headquarters. And then at the last year when I figured out I could retire, I went back and opened a brand new station out on Thompson Mill Road. Worked there for a year and retired and said, I'm done. There ain't nothing else to do. I left at an early age of 48 years old. And I decided I was going to play, and 6 months later, I'm working for Garmin in the fishing electronics business. And I worked for them for a couple years. They decided before COVID they were going to lay off the United States staff, and they laid off about 75% of their people, and I was without a job, and I was like, hey, that's cool. No big deal to me. My wife started reminding me of the people I was hanging around with. Not that it was bad, but it was everybody was 70 years old. My wife says, you need to think about going back to work. So started praying about it. Susan Bard, some of y'all might know from Lightweight Recovery, reached out to me and asked for my resume. And I gave her my resume, and about a week later I got a phone call from Dr. Rona. And we talked on the phone for about an hour, and I was like, it's kind of interesting, you know, something different. And she said, why don't you come see me? So about a week later, I went and saw her one afternoon, had an appointment to see her. It wasn't an appointment to see her, it was an interview. So I ended up talking to a group of people, and ended up accepting the job with the GNR Health. I'm considered a state employee under a federal grant, so it's really weird how it all works. I have a contract. So I was explaining to this gentleman earlier, our contract got extended now, so we're definitely going to have this program to at least August of 23, which is exciting because we're growing it and growing it and growing it. So when I started this program in December of 19, it was kind of like, what are we going to do? What's the plan? So I report to Elena Solka, who's down on the bottom, and Dr. Rona, y'all probably seen her picture a million times over the last year or so. But our area we cover, that I'm in charge of, is Gwinnett, Newton, and Rockdale counties. When I started this job, it was kind of like, okay, here it is, establish it. So there's 18 people that are doing my job throughout the state, but everybody's kind of on their own, and they're kind of without direction. And one of the things I sat down with Dr. Rona is, hey, I'm a fireman. You have to tell us to do this, this, and this, and we'll do it. So that's what I did when we started with GNR Health. First thing we did was get involved with drug-free communities. If you don't have one or are not aware of one, Guide is who's in charge of here in Gwinnett, has their own drug-free community. Great organization to work with. They have all kind of grants and literature and stuff like that, but I work with Rockdale and Newton also. We established a website, which is just opioid safety. It's gnrhealth.com/opioid safety, and it's got a lot of information on it. I started out, I gave 3 presentations to all 3 boards of health in all 3 counties, and ears started perking up. And people started going, what is this? Why haven't we heard of this? And the eyes and ears, and people started talking, and awareness really started kicking in. There's people on the Board of Health, you have people that are commissioners, you have mayors, you have medical directors for different facilities. So some people kind of knew it was going on. Some people had no clue. So since then, I've gone back and revisited some of them, and it really opened their eyes. Our next thing was to get involved with ODMAP participants. And what ODMAP is that's 75% of my job. We track the overdoses in all the 3 counties. First of all, we identified who's already using ODMAP. People had signed up for it at different conferences, but didn't really know what it was. And then we started partnering. The first thing I did was develop partners with HIDA and DEA. And HIDA, which a lot of people don't understand, they are the high intensity drug trafficking unit for Georgia and South Carolina. They have different officers from all different departments work under one umbrella, and all work together as a group. And it's right here in Peachtree Corners. And people were just like, well, we didn't know we could work with them. So now all a bunch of departments work together. The DEA, you hear about all their guys with their mask on and all that stuff. There's a whole other section of the DEA that's just community awareness. A lot of stuff that you've seen about the fentanyl that's been going on in different drugs, it's just education that DEA has offered. So they have community people that come out. And that might be another speaker for you guys too. Might be a good one. So once we met with those groups and developed partnerships, the first thing I did was meet with EMA managers, which is emergency management agencies, Gwinnett, Newton, Rockdale, and just got buy-in. Wanted them to understand what we were trying to accomplish. Then we started meeting with the police chiefs and the sheriff's departments, explaining the program, giving them more training. We have follow-up training, and then we're trying to work with some of the task force. Gwinnett has a task force, the cities have a task force. Rockdale and Conyers didn't have any drug task force, which didn't make any sense to me, because you have these city departments and then you have these county departments. So part of my job is to make them work together. So we helped create a Rockdale Conyers drug task force. Now they're meeting together, having meetings together, which is an incredible thing. Everybody's working together. I am the liaison for law enforcement throughout GNR Health. When the COVID started, when the officers were getting exposed, stuff was going on at the jail, people reached out to me because they knew that what I did with law enforcement, so that helped. One of the big things we identified when I first started is there was no Narcan training in all 3 counties. I could not understand that. Working on an ambulance for 28 years, Narcan is the only thing to reverse opioid overdoses. So it's kind of like, how do we get Narcan training in these communities? So one of the first things we did was develop a partnership with Navigate Recovery. And we offer now, and there's a flyer out on the table if you didn't get one, every other Saturday, Navigate Recovery offers free Narcan training. All you gotta do is show up at 10 o'clock in the morning, sit down for the hour class, and you leave with a Narcan kit. So that was one of the things that we wanted to develop. Since then, we've developed partnerships with Rockdale County Drug-Free Coalition and also Newton County Drug-Free Coalition, and we offer training online through Zoom. That's advertised. Some of that's kind of slowing down because in-person's starting back again, so I think that'll be a good thing for expansion. We're working right now with Guide on a law enforcement Narcan assist. One of the things law enforcement has continued to say about Narcan is that it costs so much. When I first started this job in December of 19, there was a lot of law enforcement that were paying like $150 for Narcan, but there's grants out there where they can get a discount, and all they have to do is get Dr. Ronan to sign off on the paperwork. So we started doing that. We've already partnered with Swanee, Lawrenceville, Wilbur, Duluth, and Norcross, and got all their officers Narcan. The one thing I can tell you that I'm proud of is that every law enforcement officer in Gwinnett County, city or county, carries Narcan on them now. If it's not on their person, it's in their car. So if they're the first one on the scene of an opioid overdose, they can reverse the effects of it. My next project that I'm working on, and it's not a secret because I've told enough people, is we're gonna try to get the school resource officers. I think that's the next project that we should be thinking about. It's not because it's a danger that our kids are bringing drugs and they're overdosing in schools. That's not the problem. The problem is we don't know what they're bringing from home. I mean, we've heard guns, we've heard drugs and all this other stuff that's in their backpacks that the kids didn't even know were in their backpacks. So we gotta make sure, we gotta have this protection for our kids, the teachers, the nurses, all those people. So that's the big project we're working on now. So we're trying to raise money through Guide to buy Narcan for the school resource officers. Our partnership right now, as you can tell, is with all the agencies. 2021 and 22, my projects have been working with the coroners and medical examiners' offices and some smaller police departments. The biggest thing I can tell you about law enforcement is there's a shortage. There really is. Their intel and their detective units and some of these smaller departments no longer exist because all those officers are on the road and they want to keep that active. But we're going to keep that project going. And like I said, most of my contact is with the drug task force teams. What is the OD map? And this is a good map of it. This is June 1st. I'm going to move out of the way for a second. This is June 1st to August 31st in the state of Georgia. It's unbelievable, people. 3,241 overdoses, 2,230 of them Narcan was used on, and 79 deaths that we're aware of. The problem with the death count is it goes up. This number will change within the next couple days because the GBI lab, it takes 3 to 6 weeks to get the results back from somebody that has died. The one thing I tell you, y'all don't know how blessed we are in Gwinnett County to have a medical examiner that truly cares like Dr. Terry does. She tried to test everybody that has died that comes into her facilities through blood or urine to see if opioids or fentanyl is related. And she is a big proponent of this program. But this is the state of Georgia. Like I said, I'm not going to zoom in and let you see all the way down. This is Gwinnett County for the same amount of time. We got a problem. A lot of people look at it and they go, what can we do? Well, there's a couple things we can do. Gwinnett County, you're 132 overdoses in the last 90 days. Our other involvement in this position, myself, I represent Dr. Run on 2 statewide committees. One is Strategic Planning Work Group, which is control and enforcement, and then also on the secure disposal and safe storage. You'll hear more about safe storage in the coming year, because that's going to be the next big thing. We're also members of a couple local groups, and one of the ones I'm most proud of, we just kind of started, is the drug overdose epidemic. We're putting data and action together as a work group. This is the first time it's ever been done. I love our partnership with Navigate Recovery, because we've actually reached out to the DA's office, the medical examiner's office, the county police, the city police, some recovery facilities, putting everybody's heads together and trying to figure out what we can do. The first thing that came out of this whole work group was Narcan training, and that's why Navigate does what they do. Navigate has extended that to even say now they're working on a program for all the residential homes, and I know you were talking about that, is the next thing they want to do is find out every residential home in Gwinnett County that does drug treatment, they want to be Narcan trained. So they're working on that project, and I go along with them and do the teaching too at the same time. So that's our next project. Some opioid awareness that you might see in the community. We do get some federal funding. This year we picked 15 bus shelters and 15 bus benches and put a small ad on there. And then within the next, I would say in the next 30 days, you'll start seeing free Narcan advertisement popping up on your newspaper, Spotify, Pandora, Facebook ads, and Google ads. We've got some funding for that we're going to advertise not only what we're doing at Navigate, but also any place in Gwinnett. And we're going to have a phone number where people can reach out. If people don't know where a treatment facility is, we're going to call the hotline. If they need a facility of treatment, if they just want Narcan, it'll be an information type phone number for them. But that's our community awareness, kind of what's going on. So everybody asking, every time I do these talks, I like to talk about how we're going to stop this epidemic. And there's kind of a 5-point strategy that we use: better prevention, treatment, and recovery services. If somebody goes to a hospital in Gwinnett County, they meet a peer counselor. That can, if they overdose, alcohol or drug related, they meet a peer counselor. Through DBHD's grant, Navigate Recovery sends somebody there. We're going to try to expand that program to make sure everybody gets it. We want to be able to offer them treatment. The data, that's my job, and that's what I'm trying to do, is provide more information and more meetings like we're doing today with y'all, so you can see what's going on. Better pain management. If you look around in your county, there is no pain management anymore. Most of them have disappeared. And that's because of DEA and the tracking of your prescriptions. Sometimes it's a pain to go to Publix to get your prescription, but there's a reason behind all that. The availability of overdose reversing drugs, and like I talked about before, that's where we're offering more Narcan training. And then what's next? What's better research? What else can we do? How else can we help the community? The ways that you personally can stop this: one, join one of these drug-free community organizations. See what they're doing. See if you can help out. Take part in the DEA's Take Back Days, October 23rd. Every local police department has a drop box in Gwinnett County. Go through your medicines cabinets. Get rid of your drugs. Oh, my kids are not going to be the ones. Trust me. It's not your kids you need to worry about. It's your kids' friends that come over to your house, that use your restroom, and then go through your medicine cabinet. And your kid's friend's gone. You're going to blame your son or daughter, and it's not them. It's the other people that are coming into your house. So we got to help Take Back Day. That goes back to the storage systems. The biggest thing I tell people, become a patient advocate. You don't have to be a nurse. If you go with your mom to the doctor's office, or you go with your kids to the doctor's office. One of the worst stories, when I first started this job, I think it was February of 2020, my boss at the time, Connie Russell, took her son to get his wisdom teeth taken out. The doctor gave him a prescription for oxycodone for 24 tablets. The kid was 16 years old, had 2 wisdom teeth taken out. Trust me, he can take Tylenol. Throw that prescription away. That's what we're getting. The problem is, oh, well, he only took 2. Yeah, but what you do with the other 22? If they're sitting at your house, it's just waiting for somebody to steal them and go sell them on the road. So the other option you have is safe storage. Like I said, you'll see more about that coming. But these little storage boxes, they cost $20. Keep in your house, keep all your drugs locked up. We do it at our house, and just for safety. How do I know if a loved one's affected by addiction? Some of y'all probably already seen all this. This is just some general signs: lack of control, inability to stay away from substance or behavior, decreased socialism. That was the first thing we noticed with our son, is he's kind of separated from the family and kind of started doing his own thing. But we caught it, I think, soon enough. He spent a little time in the correctional facility on High Hope Road, and they fixed him. And then he went to rehab for 2 years, so he's doing really good. But ignore the risk factors. You know, not only just finding a needle at your house is weird, but finding your spoons are missing, your medication bottle isn't the same place you put it on the counter. Somebody looked at it or somebody moved it. Just little bitty things like that that help you figure out what's going on. There is help available. GCAL is a great service that's available. The crisis, they don't care 24/7, you can call them. There's also a national helpline through SAMHSA where it will help you locate a facility for treatment if somebody wants treatment. You can't do it for them. That's the one thing I can tell you. Is your son or daughter or family member, whatever, they have to decide they want treatment. You can do all you want, but it is not going to matter. But that's my contact information. I'd be glad to help anybody with any more information if you want to. Make sure you take that pamphlet that I gave you, and there's also the Narcan thing. But thank you for your time today. Appreciate it.
Great, thank you.
Anybody have any questions?
Put your contact on both sides, right?
Yeah.
Yes, please.
Whoops.